Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
There's been a lot of research over the past few years on the role that mental health plays in the body as a whole. Mood disorders such as anxiety and depression can have extremely adverse effects on our physical well-beings, especially for seniors. Whether it's memory loss, coping with the loss of independence, or managing the grief of losing a loved one. All these factors can take a significant toll. Today, we'll talk about the signs to watch for, medications that can help or hurt, and what caregivers and families can do to ensure the mental well-being of older adults in their lives, as well as answer your questions on this episode of Ask the Doc. Hi, welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Anthony Marcaida, a board-certified psychiatric mental health nurse practitioner with Neuro Wellness Spa. Our first question of the day comes from Rosa, who reached out to us through our website, allhealthtv.com. Rosa's question is, Hola, Mr. Marcaida. My grandfather passed away last year, and mi abuela has been pretty depressed ever since. Her GP wants to start her exercising. I guess my question is, how does physical activity contribute to mental health, and what types of exercises are particularly beneficial for seniors? Thanks for writing in, Rosa. This is a really important question you're asking. Now, physical activity plays a significant role in promoting mental health by boosting mood, reducing anxiety, improving sleep quality, and enhancing overall cognitive function. For seniors, exercise can be especially beneficial as it helps counteract age-related decline in both physical and mental health. Here's how it contributes to mental health, along with specific types of exercises particularly suitable for seniors. So as mentioned, it can reduce anxiety and depression. Exercising releases endorphins, which improves mood and reduces levels of cortisol, which is a stress hormone. Exercise improves sleep. Regular physical activity can help regulate sleep patterns, contributing to better mood and physical recovery. Exercise can enhance cognitive function. Exercise increases blood flow to the brain, which supports memory, attention, and processing speed, important for combating age-related cognitive decline. Lastly, it can also provide social connections. Group exercises such as walking groups or senior yoga classes offer social engagement, which is essential for mental well-being. The types of exercises include aerobic exercise, such as walking, swimming, or cycling are gentle on the joints and help improve cardiovascular health. Strength training, such as using light weights or resistant bands, can help maintain muscle mass, support joint health, and improve balance, all crucial for reducing the risk of falls. You can also do balance and flexibility exercises such as Tai Chi, yoga, or specific balance-focused routines, which improve stability and prevent falls while enhancing mental clarity. Lastly, mind and body exercises. Again, such as Tai Chi or yoga, they're very beneficial for seniors. They combine gentle movements and breathing techniques. Now, thank you for that question, Rosa. Our next question comes from Will, who reached out through our Instagram page. Will asks, Hi, Doc. My father's been pretty stressed because my stepmother was just recently diagnosed with breast cancer. His primary care physician wants to prescribe some antidepressants or anti-anxiety meds to help him cope. But I'm concerned they might not interact well with his diabetes and arthritis medication. What are your thoughts on this? Hi, Will. Sorry to hear that your family is going through such a tough time right now. Our thoughts are with you. You're asking a great question, and I'm happy to hear that you're advocating for your father. Yes, antidepressants and anti-anxiety medications can interact with medications for diabetes and arthritis. Here's a breakdown. As far as diabetes medications, some antidepressants such as SSRIs can alter your blood sugar levels, either decreasing or increasing them. Some medications can cause weight changes. These medications are typically either an antidepressant or even an antipsychotic. There's always a risk for hypoglycemia. Hypoglycemia is when your blood sugar goes low. So it would be very important to definitely monitor blood sugar. As far as the interactions with arthritis medications, most common medications used for arthritis are NSAIDs, non-steroidal anti-inflammatories. These medications, such as ibuprofen or naproxen, when taken with an SSRI, can increase gastrointestinal bleeding. So combining NSAIDs with some antidepressants, especially SSRIs or even SNRIs, requires caution. Lastly, steroids, which are also used for arthritis, can actually amplify anxiety or agitation. Corticosteroids can also affect blood sugar, complicating diabetes when used with antidepressants. So again, thank you for your question. I would definitely recommend you monitor blood sugar. If you don't already have a blood sugar machine, talk to your primary care provider and see if you can get one for the house. Again, thank you for that question. Let me go on. And we've got another All Health TV question here. Love it. It's from Felicia, who asks, Anthony, my Aunt Susanna is a widow and lives across the country with no kids of her own and her friends beginning to pass on. I have a feeling she's getting kind of lonely. I'd like to know what role loneliness plays in mental health issues for senior citizens and what can be done to alleviate it. Hi, Felicia. Your aunt is lucky to have you as a niece. Loneliness can have a very detrimental effect on mental health. Loneliness can significantly impact the mental health of senior citizens, often exacerbating conditions like depression, anxiety, cognitive decline, and even physical health conditions like cardiovascular disease. Social isolation, which many seniors experience due to the factors like retirement, loss of loved one, reduced mobility, or health limitation, compounds feelings of loneliness. Here's a closer look at the effects and potential interventions. Some of the effects include risk of depression and anxiety, cognitive decline, worsening physical health, and mortality risk. Now, some strategies to alleviate loneliness for seniors include social engagement. You can have your aunt visit a community center or a senior program. Some local centers have social events, group exercises, or educational programs tailored for seniors. You can have your aunt try volunteering. Many seniors find purpose and connection through volunteering, which also helps them engage in meaningful activities and combat feelings of isolation. There are religious and spiritual groups. For those inclined, attending church, temple, or other religious gatherings can foster a sense of community. For those who are immobile, you can try to facilitate virtual connections, such as Facebook, or you can FaceTime family members or friends across the country. I would definitely recommend encouraging physical activities and exercise. There are group exercises that your aunt can join. Fitness classes for seniors, such as gentle yoga, walking groups, or aqua aerobics, allow them to stay active while engaging socially. There's physical therapy and mobility support. This ensures seniors maintain their physical mobility through physical therapy. If necessary, it can help them stay engaged and in the community and reduce isolation. Lastly, one option to combat loneliness would be pet ownership. Having a pet can provide companionship, reduce feelings of loneliness for seniors capable of caring for an animal. Even small pets like birds or fish, they can provide support. For those of our senior family members who are immobile or cannot care for an animal, there are therapy animals. You can contact a program out there that can have a therapy animal come out to the home, or if your family member's in a nursing home, they can come out and visit the facility. Again, Felicia, thank you for that question. Our next question comes from Irving, and this comes to us through YouTube. Hi, Anthony. My lovely wife, Adrienne, and I are both in our 70s and in pretty good health. But if we're being honest, we've both noticed that we're not as on the ball with our respective memories. as we used to be. We want to know how seniors like ourselves can maintain good cognitive health and reduce the risk of dementia or Alzheimer's disease. Hi, Irving. We appreciate your reaching out with your question. Maintaining cognitive health as we age is so important. There are many evidence-based strategies to help keep the mind sharp and reduce the risk of dementia and Alzheimer's disease. This includes staying physically active. Regular aerobic exercise like brisk walking, swimming, or cycling has been shown to improve blood flow to the brain and can encourage new neuron growth. Strength training can also help maintain overall health, which indirectly supports cognitive function. Eat a brain-healthy diet. The Mediterranean diet is particularly beneficial for cognitive health. They emphasize whole grains, lean proteins, fish, which is rich in omega-3s, nuts, leafy greens, and antioxidant-rich fruits and vegetables. These nutrients can protect cells from damage and reduce inflammation. Another way to combat dementia and preventing Alzheimer's would be engaging in mental exercises. Do activities that challenge you. Activities such as reading, learning a new skill, playing a musical instrument, doing puzzles, or even socializing. These can strengthen cognitive resilience. Cognitive training games and apps designed to enhance memory and problem-solving skills are very helpful. Manage your stress. Chronic stress can lead to structural and functional changes in the brain. Mindfulness, meditation, and other stress reduction techniques like yoga or Tai Chi help reduce stress, potentially supporting brain health. Get quality sleep. Good sleep is essential for memory consolidation and clearing out toxins in the brain. Aim for 7 to 9 hours a day. Stay socially connected. Engage with your family members, your community. This mental stimulation can help combat depression and loneliness. Monitor your cardiovascular disease and avoid smoking and limit alcohol if you do drink. Again, a combination of all of these can help prevent Alzheimer's, especially as you age. Thank you for that question. And let me go on with our next question here. We've got another YouTube question. This time it's from Evangeline, who asks, Doctor, my husband Shelly, which is short for Sheldon, hasn't really been himself lately. He's usually a pretty upbeat guy, but he's been kind of sullen since his physician put him on a new medication for hypertension. Is it possible for some meds prescribed to seniors to have the potential to cause or worsen depression or anxiety? Evangeline, it's very possible for something like that to happen. Thanks for sharing your story with us. Yes, absolutely. This is often due to medication's effects on neurotransmitters, blood pressure, or other physiological processes. Here are a few to consider. Some antihypertensives can cause blood pressure effects. Beta blockers, such as propranolol, has been associated with mood changes, including depression and anxiety. If your family member is on a corticosteroid, such medications like prednisone, which is used to manage inflammation or autoimmune conditions, can cause mood swings, anxiety, or even worsen depressive symptoms. Lastly, one common medication are statins or anti-cholesterol medications. Although rare, some cholesterol medications have been reported to cause mood changes, including depression and fatigue, which may indirectly affect mental health. Again, thanks for that question. Let me go on to the next question here. Ooh, we've got a really important Facebook question here. It's from Christos, and he wants to know, hey, Anthony, my pops was told by his best friend Stanley that he should add some supplements to his daily regimen. Sounds kind of sketchy to me. So I'd like to know what role supplements or herbal remedies play in supporting mental health in seniors, and how do they interact with prescription medications? Well, thanks for that question, Christos. So supplements and herbal remedies can play a role in supporting mental health in seniors by potentially alleviating symptoms of mood disorders, anxiety, and cognitive decline. However, they must be approached cautiously, as many supplements and herbs can interact with the prescriptions and medications and other health conditions common in adults. First, I'm going to name a few common supplements, such as omega fatty 3, which is great for anti-inflammation, vitamin D, which is often linked with better mood. There are your B vitamins, vitamin B, vitamin B6, and folate. These are essential for helping reduce depression and improve cognitive function. Magnesium, it's associated with anxiety. Magnesium supplements may help reduce these symptoms. There's also ginkgo biloba. Commonly used to improve cognitive function, ginkgo biloba may enhance memory and reduce symptoms of dementia. Some other common herbal remedies include St. John's wort. This is often used to help improve your mood. There's ashwagandha, which is known to relieve stress, also help with sleep aid. Lastly, valerian root, commonly used for anxiety and insomnia. Now, some of the most important interactions you have to keep an eye on are with, for example, St. John's wort. If your family member is on an antidepressant, St. John's wort can have interaction with SSRIs. This could actually cause a condition called serotonin syndrome. The next interaction to watch out for would be with ginkgo biloba. This can increase the risk of bleeding when taken with a blood thinner, such as warfarin or Coumadin, for patients who have arrhythmias. Lastly, magnesium and calcium. These supplements can interact with antibiotics and certain heart medications, reducing their effectiveness. While certain supplements and herbal remedies can support mental health in seniors, they require careful management and open communication with your healthcare providers. Thank you for that question. And well, it looks like we got another question from the gram. This time it's from Lorena, who asks, Hola, Mr. Marcaida. My mother has early stage dementia and she moved in with the family. What should caregivers like myself be aware of when a senior starts a new medication for mental health in terms of monitoring effectiveness and potential side effects? Hola, Lorena. This is a really important question, and I appreciate you reaching out to us. First, I'd like to applaud you for having your mother live with you instead of relegating her to a nursing home. When seniors begin a new medication, it's important to monitor for side effects. Certain side effects can include observe for mental health changes, risk of fall. Sometimes these medications can cause dizziness. Monitor for hydration and appetite. Certain meds can reduce appetite, increasing thirst, which are signs of dehydration. Certain medications can interact with other medications. Therefore, it's important to consult with your primary physician to make sure there are no interactions with current prescription. Lastly, monitor for any behavioral or cognitive changes. If you notice any confusion, agitation, memory loss, it's important to stop the medication and consult with your provider. Keeping a daily log of symptoms, side effects, any notable behavioral or physical changes can be helpful, to discuss with your healthcare providers. Okay, next question is from Ariel, who reached out to us on allhealthtv.com. You should really check the website out when you get a chance. It's chock full of great information. Ariel's question is, hey doc, what are the risks and benefits of using antipsychotic medications to treat conditions like severe depression or anxiety in seniors? Hey Ariel, we appreciate you reaching out and sharing your question with us. Using antipsychotic medications to treat severe depression or anxiety in seniors is sometimes considered when other treatments have proven ineffective, but it involves a balance of risks and benefits. Some benefits include symptom management, such as, management for their depression, anxiety, and agitation, mood stabilization. Some seniors experience severe mood instability, such as paranoia, hallucinations, or extreme agitation. Another positive and benefit of using an antipsychotic is in extreme cases when there's extremely high anxiety or aggression where immediate intervention is necessary. Antipsychotics can help calm patients quickly, which can help in preventing harm for themselves or others. Some of the risks involved include increased mortality, cognitive decline, metabolic side effects. Antipsychotics are known to potentially cause weight gain, movement disorders, such as extrapyramidal symptoms or tardive dyskinesia. This is classified as involuntary movement of muscle Seniors are more susceptible to these side effects. Once they occur, they may be difficult to remove. Antipsychotics place you at risk for falls and fractures. Due to sedation or motor side effects, antipsychotics can increase the risk of falls and fractures, which can lead to decline in health and mobility. Lastly, if there's any withdrawal or discontinuation, some seniors develop dependency or antipsychotics and medications. Stopping them can lead to withdrawal symptoms or a rebound effect or worsening of anxiety and agitation. Thanks for that question. Now I'm going to go over to our next question here. This next question comes from Toshi, who reached out to us via Facebook. Toshi asks, "Hello, Anthony. My father, Tadashi, is in his 70s, and his primary care physician put him on an antidepressant. My mother passed away last year, and my father is kind of lost without her, hence the meds. I'm obviously worried about him and would like to know what role do antidepressants and other psychiatric medications play in reducing as well as increasing the risk of suicide in older adults. Tadashi, condolences to your loss." You ask a great question. Not only do antidepressants help to improve mood, but they do occasionally have the opposite effect, unfortunately. First off, they help by alleviating symptoms of depression. Many older adults experience depression and other mood disorders, which are significant risk factors for suicide. Antidepressants can help alleviate these symptoms, improving mood, increasing energy, and reducing feelings of hopelessness, which collectively lower suicide risk. Antidepressants can improve anxiety and also manage stress. These can enhance social and cognitive function, therefore leading to a better outlook on life. Now, to touch base on your biggest concern about the suicide risk, in the early treatment phase, some patients, especially in older adults, may experience energy before mood improves. This temporary elevated energy level can cause patients to feel more physically capable to act upon suicidal ideations. Other side effects include agitation, insomnia, or increased anxiety. These side effects may contribute to suicidal ideation, especially in those already at risk. Polypharmacy. Older adults often take multiple medications for different conditions, increasing the risk of adverse interactions. Poorly managed interactions or combined side effects could worsen mood or cognition, unintentionally raising suicide risk. And there could be a new emergent suicidal thought, which is rare. Some patients may develop new suicidal thoughts when beginning antidepressants, typically within the first few weeks. This effect is thought to be more common in younger patients, but should be carefully monitored in older adults as well. Well, that's all the time we have for today. I'm Anthony Marcaida. I'll see you next time on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.